Hello class, my name is Trisha Miller and today I will be discussing time management, resiliency, and stress. There are 4 different time management strategies and techniques in our book that's by Huber and Joseph. The first strategy is cognitive stacking. This technique involves making lists of tasks that need to be completed during your workday. Huber and Joseph, 2022. The second strategy is prioritization. Prioritization involves using the acronym CURE to prioritize tasks. CURE stands for critical, urgent, routine, and extra. Huber and Joseph, 2022. Routinization is the third time management strategy, and it means to develop a work routine that works for you and keep doing that. Huber and Joseph, 2022. The final technique that is listed in our book for time management is time audits. Time audits involve tracking the time you use at work for 1 to 2 weeks to find time for tasks to be completed. Huber and Joseph, 2022. I tend to use prioritization and routinization for time management during my shift at work. When I receive a report about the group of patients that I will be caring for, I mentally and on paper prioritize which patient needs attended to first and which tasks are the most important. I have also developed a routine over the years of how I accomplish things, and I stick to this routine unless an emergent situation occurs. These 2 time management strategies have helped me be efficient and effective in delivering patient care. There are evidence-based time management strategies that can help nurses complete tasks in a timely manner and improve patient satisfaction at the same time. Purposeful rounding is a technique where nurses ask patients about the 4 P's: pain, position, potty, and possessions. Kelly, 2017. Purposeful rounding is aimed at addressing all of the patient's concerns and or needs while in their room, therefore reducing the patient's need to use the call light. Purposeful rounding combined with clustering care can improve patient satisfaction by reducing interruptions in sleep. Kelly, 2017. It is all a time management strategy for nurses. If you know that you have to administer medication at 2 p.m. and the patient also has a dressing change and may be incontinent, you can plan to go into the patient's room with the patient care technician or another nurse to do all 3 things during that one visit. Resilience is defined by Huber and Joseph, page 88, as the ability to bounce back. There are several qualities that are similar to resilient people. Resilient people tend to have a good self-image, are optimistic, organized, have good communication skills, have self-control, and are empathetic. Huber and Joseph, 2022. Most of these qualities are something you either have or you don't, according to Huber and Joseph, 2022. Empathy and optimism are qualities that can't really be learned. I think that some qualities can be developed or improved. Communication skills and organization can be developed or learned. Some people may be innately better at these skills, but I think they can be developed. Self-control and a good self-image are questionable whether they can be learned or developed. They may be able to be improved over time. Stress is an inevitable part of the workplace for nurses. Nurse leaders can use strategies to decrease this stress. Open communication with employees tends to decrease stress levels. Huber and Joseph, 2022. Managers can foster a positive work environment with communication and relationship building. Huber and Joseph, 2022. Our book also suggests starting a nurse residency program for new nurses that helps the transition from nurse graduate to practicing nurse. The nurse residency program lasts for 1 year and gives support to new nurses. Nurse leaders can also model positive behavior for other nurses. Positive behavior by leaders promotes a good work environment and decreases stress. Individual nurses can cope with stress by using strategies to minimize work stress. Some of the strategies recommended by Huber and Joseph, 2022, page 89, are journaling, taking time away from the job, setting boundaries, using relaxation techniques, and develop healthy habits. Healthy habits for relieving stress can be exercise, hobbies, healthy diet, and getting enough sleep. Wellness programs through the workplace that focus on prevention of stress-related problems are also encouraged. Huber and Joseph, 2022. In conclusion, nurses caring for patients are on a time schedule. Time management strategies are important for developing ways to safely and efficiently care for patients. There are many factors that can cause workplace stress for nurses. It is important for nurses to learn to manage their stress levels. Nurse leaders have a critical role in decreasing stress levels and improving the work environment. Nurses have proven over the years that they are resilient to circumstances and can adapt to care for patients when needed. I am proud to call myself a nurse. Thank you. Tricia Miller.